Do you have trouble sleeping at night? You're not alone. In fact, over 60% of Americans report having some sleep problems, and it's even more common among seniors. The good news is that there are proven tips that can help you get a better night's sleep no matter what your age. So if you're over 60 and struggling to sleep, keep watching for some simple but effective solutions. Hey everyone, welcome back to our channel where we bring you the latest health and medical information. Today, we will discuss a very common problem that many seniors face, which is trouble sleeping at night. According to the National Institute on Aging, insomnia affects about 2/3 of all adults over the age of 65. There are several factors that contribute to this problem, such as medical conditions, medications, and psychological issues. But the good news is that there are things you can do to improve your sleep habits and get the rest you need. We have compiled some proven tips that can help you achieve a peaceful night's sleep. So let's dive in and explore how you can overcome insomnia naturally. Tip 1. Stick to a regular sleep schedule. It can be tempting to stay up late and sleep in on the weekends or whenever you have free time. However, this can disrupt your body's natural sleep cycle and make it harder to fall asleep at night. To avoid this, try to go to bed and wake up around the same time every day, even on weekends. This will help regulate your body's internal clock and make it easier to fall asleep when bedtime comes around. Additionally, going to bed at the same time each night will allow you to get the full 8 hours of sleep recommended for adults over 60. A study published in the Journal of Gerontology found that older adults who maintained a regular sleep schedule had better sleep quality and fewer daytime sleep disturbances than those who did not. Tip 2. Create a relaxing bedtime routine. One of the best ways to prepare for a good night's sleep is to create a relaxing bedtime routine. This could include taking a warm bath, reading a book, or listening to calming music. Try to avoid stimulating activities such as watching TV or working on your laptop in the hour before bedtime. The blue light emitted from these devices can interfere with your body's production of melatonin, a hormone that helps promote sleep. Instead, choose calming activities that will signal to your body that it's time to wind down. For example, practicing deep breathing exercises or meditation can also be helpful in clearing your mind of any thoughts or worries that may be keeping you awake. A study published in the Journal of Holistic Nursing found that older adults who practiced a 10-minute relaxation technique before bed experienced improved sleep quality and reduced anxiety. Tip 3. Optimize your sleep environment. If you want to get a better night's sleep, it's important to optimize your sleep environment. Make sure your bedroom is dark, quiet, and cool. You can use blackout curtains or an eye mask to block out any light, earplugs to reduce noise, and a fan or air conditioner to keep your room at a comfortable temperature. In addition, ensure that your bed is comfortable and supportive. An old or lumpy mattress can cause aches and pains, making it difficult to fall asleep. Consider investing in a new mattress or using a mattress topper to add cushioning. Another important aspect of optimizing your sleep environment is to keep your bedroom clean and clutter-free. A messy room can be distracting and make it harder to relax. Take some time each day to tidy up and put away any items that don't belong in your bedroom. By creating a clean and relaxing atmosphere in your bedroom, you'll be able to get a better night's sleep. Tip 4. Get some exercise. During the day, exercise can help promote better sleep, but it's important to time it correctly. Try to get some physical activity during the day, but avoid exercising too close to bedtime. A study published in the Journal of the American College of Sports Medicine found that older adults who engaged in regular physical activity had better sleep quality than those who were sedentary. Aim for at least 30 minutes of moderate-intensity exercise most days of the week. This could include activities such as brisk walking, cycling, or swimming. Just be sure to consult with your doctor before starting any new exercise program. Tip 5. Avoid large meals. Before bed. Eating a heavy meal before bed can make it difficult to fall asleep and stay asleep. The body works hard to digest food, which can keep you awake and prevent you from entering the deeper stages of sleep. To avoid this problem, try to finish dinner at least 2 hours before bedtime. If you're hungry, you can have a small snack, but avoid sugary or fatty foods. A study published in the Journal of Clinical Endocrinology and Metabolism found that eating a high-fat meal before bed led to poorer sleep quality and increased insulin resistance in older adults. Tip 6. Limit caffeine intake. Caffeine has a half-life of 5 to 7 hours, meaning that it can still be in your system keeping you awake by the time you want to go to bed. To avoid this, try to limit your caffeine intake to earlier in the day. You may need to avoid caffeine altogether if you're sensitive to it or have certain health conditions. In addition to avoiding caffeine, you should also limit your alcohol intake, especially before bed. While a nightcap may help you fall asleep faster, it can disrupt your sleep cycle later in the night and lead to poor sleep quality overall. Alcohol can also interact with certain medications, including those for sleep, making it harder to get a good night's rest. Tip 7. Rule out medical conditions. If you've tried the tips above and are still having trouble sleeping, it's important to rule out any underlying medical conditions. Certain conditions, such as sleep apnea, restless leg syndrome, and thyroid disorders, can make it difficult to sleep. Sleep apnea, a condition in which a person's breathing is interrupted while they sleep, is common in older adults and can cause insomnia. Restless leg syndrome is a neurological disorder that causes an uncomfortable tingling sensation in the legs, which makes it hard to fall asleep. Thyroid disorders can also interfere with sleep patterns. If you suspect you may have one of these conditions, consult with your doctor for diagnosis and treatment options. Tip 8. Talk to your doctor about medications. If you suspect that your medications are contributing to your sleep problems, talk to your doctor. Certain medications, such as antidepressants and stimulants, can make it harder to sleep. Your doctor may be able to adjust your dosage or switch you to a different medication that doesn't interfere with sleep. In addition, some over-the-counter medications, such as pain relievers and cold and flu medications, can also cause sleep problems. Read the labels carefully and avoid taking medications that may interfere with your sleep. Tip 9. Consider cognitive behavioral therapy for insomnia. If your insomnia is severe or persists, despite trying other treatments, consider cognitive behavioral therapy for insomnia, or CBT. CBT is a form of psychotherapy that can help identify and change negative thoughts and behaviors that contribute to insomnia. This approach has been shown to be effective for people over 60 with chronic insomnia. A study published in the journal Sleep Medicine Reviews found that CBT was effective for older adults with insomnia, leading to improvements in sleep quality and reduced use of sleep medications. Tip 10. Use sleep aids as a last resort. Sleep aids can be helpful in some cases, but they should be used as a last resort. Over-the-counter sleep aids such as melatonin supplements and herbal teas may help promote sleepiness. However, it's important to talk to your doctor before taking any supplements or herbs, as they can interact with other medications you're taking. Prescription sleep aids can be effective, but they can also cause side effects and may be habit-forming. Therefore, they should only be used under the guidance of a healthcare professional. Getting a good night's sleep is essential for maintaining good health and well-being, especially for older adults. If you're over 60 and struggling to sleep, we encourage you to try the tips we've discussed. Remember to stick to a regular sleep schedule, create a relaxing bedtime routine, optimize your sleep environment, get some exercise during the day, avoid large meals before bed, limit caffeine intake, rule out medical conditions, talk to your doctor about medications, consider cognitive behavioral therapy for insomnia, and use sleep aids as a last resort. Sweet dreams.